Welcome to the Bent by Knowledge podcast. All right, welcome back, everybody. Today I am super excited to be here, just like any other day, but more importantly, because this is a topic that I am not particularly knowledgeable in. So I'm excited to have another professional who is knowledgeable in this field educate me along with you. So today, which I'll talk about a little bit later, we're going to be talking a lot about thyroid problems and how that affects your body, and then how we can, with lifestyle behavioral changes, impact those negative effects or those burdens. So today here with me, I have Meg Green, and I will let her introduce herself because I think that you have so much experience that situated you in a way that you can talk about these things. So I would love for you to introduce yourself, maybe any professional or personal experience that makes you the person to talk about this field.
Awesome. Well, I'm so excited to be here. I am a registered dietitian, and I've been practicing as a dietitian for the past 15 years. I started out at St. Jude Children's Hospital and really focused on pediatrics right from the get-go for my internship and residency program. And then I moved over to Children's Hospital, and I worked and practiced there for 12 years. And then decided to take a change when it was ready for my husband and I to grow our family. We just said, you know, I'm working with kids and trying to have kids of my own. It's time for me to kind of step back. And so I decided to focus on wellness and adult health and just getting back to the roots of whole health and really working with the benefits of food from farm to table, doing gardening classes and cooking classes and how to utilize those foods and what it actually gives you, those nutrients and vitamins and minerals and what it does for our bodies. And in this time period, my husband was diagnosed with a genetic heart condition that we didn't know about. And so got super stressed out trying to manage all of that. My daughter was diagnosed with that gene as well, so unexpectedly. And then I was diagnosed with an autoimmune disease, but I was misdiagnosed. And we can talk about that because that happens a lot with thyroid disease. And so I kind of was feeling bad going from different providers and getting told so much different information that I was just didn't know what to do. I just knew I felt bad and I needed help, and I just wasn't able to find that support. And I sat and I was crying and I was like, hold on, I'm a medical professional. I know about this stuff. I am going to treat myself as a patient and start with me as like patient number one. So I really dove into some therapeutic, holistic type of things, functional nutrition, and really kind of looked into functional medicine and worked with somebody that was in Little Rock as well that was like, hey, Meg, I think this would help you, a nurse practitioner. And lo and behold, I have Hashimoto's disease, and I wasn't getting the right labs tested, and I wasn't really supporting my body the way that I needed to, which I needed to just make some changes with food. And so I'm now working specifically with women. Because of that, I did not know what to do. I was, Dr. Google was telling me all this information, and I feel women need that support. And so after I started feeling better and having all of this energy, my friends are like, what's going on? What has happened? And I would tell them, they're like, sign me up. How do I get you to help me? And I was like, I don't know, guys. And so then they're like, please start a private practice. So I've now started a private practice because so many people have reached out saying, that's me. I need that support. And it's true. There's women all over. And so men, do have thyroid issues, but are really, really focused with women. And so that's how I've got here. I'm now the only integrative and functional certified nutrition practitioner in the state of Arkansas, which is amazing. But it just shows you how much support we actually need for this area. It's big.
Yeah. And I think your story is awesome because I think you connecting with the disease yourself allows you to have empathy for women, because I do think, like you kind of alluded to, this field is so like elusive,
Yes.
So everybody, I feel like everybody and their mom says I have a thyroid disorder. If I like gain 5 pounds, I have a thyroid disorder. But I mean, it's sort of like the whole story with allergies. Like you can have a sensitivity, but it doesn't mean you have an allergy. But when you have an allergy, like this is a serious issue and we need to treat it. And so I think it can be a confusing world for women. And so education from professionals like you, I think, is so important. So I would love to jump right into this thyroid conversation.
Let's do it.
So talk talk to me first about what the thyroid is, the gland itself, what it does, what it produces, and the effects that it has.
So for it to be such a small little part of our body, it is very mighty. It is a little butterfly-shaped endocrine gland that is kind of like right around our Adam's apple, and it controls almost every aspect of our body. It controls our metabolism, our temperature, and we will go into just how much what all it does actually control, but it has hands on everything: heart rate, breathing, sleep, you name it. And it secretes thyroid hormone into your bloodstream, and then it travels around to all of the different body parts and functions that it needs to go to. And so it really is small, but plays a huge role in all of your functions to survive. You have to have your thyroid to be able to survive, or the thyroid hormones. If you've already lost your thyroid, you have to have those hormones to be able to survive.
Yeah. And so what hormones does the thyroid secrete then?
So it's interesting because this is where a lot of people get misdiagnosed. Sometimes you can go into your doctor, and you do, and I think doctors hear a lot, I feel like I'm just gaining weight, or I'm really tired. I think something's going on with my thyroid. Everybody has a thyroid problem. I myself have thought that with some of even my patients when I first started out as being a dietitian. It's like everybody wants to blame the thyroid, but there's a lot that goes into it. And so your main thyroid hormones are T4 and T3. Now, there are some other ones, but those are the main ones that we kind of will focus on today. And then you'll hear a lot about TSH, and that's actually something that your pituitary gland will kind of signal to your thyroid, like, hey, you need to make more thyroid hormones, or you need to back off on the thyroid hormone. And so that is your signaling, that TSH. And so most times when you say, I think something's going on with my thyroid, the doctors will check that TSH level. That's just the signal. That is not the actual thyroid hormone that is playing a part in the body. Yes, it kind of does help. And when you look at your thyroid hormones, you do want to get a TSH, but most of the time that is all that they look at. And you can have thyroid problems and dysfunction and disease and still have a normal TSH. So really looking into free T4 and free T3. And free T3 is really the main one. Free T4 is also secreted, and that's like 80% of the hormone that's secreted is free T4. So it's the most abundant that's secreted. But free T3 is the most potent and the most active form. And so that's really what's important, is to make sure you have free T3. And so a lot of times doctors sometimes will order just T4. And so that is, you have some that are bound to proteins and some that are not bound. And those unbound ones are the ones that can really be used.
They're like single ladies. They can
I know. So they have, and the same for the free T3. You have T3, that's your total, which the ones that are already bound to your proteins, and then the ones that are available to be used. So you can get a T4, and so that's what happens. They'll just maybe get a TSH and a T4. That still isn't a good picture of what is actually going on. And so really being an advocate for thyroid health and knowing your labs that you really need to get is huge. It is huge. And it is seen, I've seen it time and time again. People come in and are like, my doctor said my thyroid was fine. What labs did they run? TSH. It's like, help.
Yeah. It's crazy that that's happening at the doctor's end too. Like they're supposed to be the people that know what they're doing.
I know.
Okay, so just to recap, there's this axis. So you have in your brain the pituitary gland, which is a little P-shaped organ that secretes all these hormones that downstream impact other things. So pituitary gland in your brain secretes thyroid stimulating hormone, TSH. And that TSH tells your thyroid, which is sitting in your throat, to secrete T3 and T4. And when those little hormones go circulating out in your body, sometimes they're bound up to proteins like albumin and things like that. And when they're bound, just like if you're in a relationship, you're no longer available. So you can't really do anything.
You're done.
The free ones, though, are the ones that really impact things.
Yes.
And so now when we're looking really downstream, when you do have free T3 and T4, what are some of the effects of those hormones?
So a lot of free T4 can make free T3, which is cool. And so, and they can make that in your liver and in your intestines and, other parts of your body. and that's nice. And what's neat about those hormones is that you have to have iodine. So that's what it is, you know, T3 means there's 3 different iodines attached to it. T4 means there's 4 different iodines attached to it. And so iodine is another thing that you have to really kind of focus on. But when, let's say, you have T4 and it's the free T4, but it might not be making enough T3, then that is when you're going to start to see some effects and feel very tired, very fatigued. Your metabolism just slows down. Everything kind of slows down. Your heart rate slows down. Your body temperature is low. If you're one that just never ever has a fever, or if you do break over 100, most likely something's going on with your thyroid. Your breathing might be slow. Your periods, oh my gosh, it wreaks havoc with your period, your sleep cycle, your sex drive changes. I mean, all of these different things, severe brain fog, depression, anxiety, all of these things can stem from just not having the right amounts of that T3, free T3 hormone, or it could be that you just have, you know, T4 that's converting it, but it's not converting it to the T3. Because sometimes you can have this, what's called reverse T3. And that's kind of the brake. That's like a brake hormone. And so sometimes you can actually be converting it to the wrong type and still have this issue. So really looking at reverse T3, free T3, free T4, TSH. And then there's another whole side of it with autoimmune disease, which is what I have, is Hashimoto's. And so you have to look at some thyroid antibodies too.
And when you say thyroid antibodies, can you explain that a little bit more?
So that is when your body literally starts to attack itself. And so what happens a lot of times is that Hashimoto's is an autoimmune disease, but it gets treated as a thyroid condition because the thyroid is involved, but it is actually, you know, just giving yourself something that gives the body T4, usually what happens, like Synthroid or levothyroxine. That's just extra T4. But if your body is attacking the thyroid, due to, and it could be a lot of times from pregnancy, you know, you have a swing in your immune functions with pregnancy, before pregnancy and right after pregnancy. And so that swoosh can just sometimes cause an autoimmune disease. Stress is a huge factor. Having chronic stress, because all of that plays into that HP excess that you were just talking about. Your cortisol plays a big role into your thyroid, and it will restrict that T4 converting into T3. And then cortisol, you know, plays a role in with your other hormones as well. And so there's just there's a lot that goes into it, but that autoimmune disease a lot of times could be coming from, maybe there's a lot of inflammation going on, and it could be from the gut, you know, having an unhealthy microbiome, leakiness of some of those bacteria or some food particles. And gluten is a big one, because gluten, the actual cell of gluten, is very similar to your thyroid cells. And so your body will start to, you know, if gluten is kind of seeping through the cracks of your gut lining, it'll attack that, because that's what it does. You know, it's supposed to attack something that's not there. It's supposed to be there. Well, then it mimics that gluten cell and sees the thyroid cells and attacks that too. So a lot of times people that have autoimmune Hashimoto's needs to really watch out for gluten.
Yeah.
In the diet.
Well, we'll definitely get into all that stuff. That's so interesting. So it is very, very complex is what I'm hearing. Like with that whole axis, you can have issues along the whole way. So you might have a brain tumor that impacts the pituitary gland. So you get impairments in the secretion of TSH. You might have a tumor or an autoimmune disease that directly attacks your thyroid. So it impacts hormone secretion. Or I don't know, maybe I'm just pulling this out of my butt, but like maybe you have an autoimmune disease that affects the downstream organs. And so you don't have the receptors on those organs that you need to be able to link up T3 or T4 with that cell. And so you don't have the expression of whatever downstream effect it should have. So such a complicated process.
It is. And you know, the thyroid also helps control your motility of your gut. So a lot of times when people have a sluggish thyroid, you'll have constipation issues because things aren't moving through the gut. So you have a lot of malabsorption. Well, your thyroid really, really needs lots of different things, but like selenium, zinc, iron. There's your omega-3s play a big role in it. Amino acid tyrosine, helps bind with tyrosine and iodine. That's what helps form those thyroid hormones. So a lot of deficiencies, magnesium, and we have a lot of deficiencies just because we don't have enough. Vitamin D is really a big factor in it as well. And so you have this slow motility, or you're not eating the right foods, and so you have these deficiencies, and then your thyroid's just not able to function because it doesn't have the teammates that it needs, on the sideline. They don't have those players to go in to even do the job that it's supposed to be doing.
Little double whammy, crazy.
Oh.
Well, okay, so you mentioned Hashimoto's, and that, from what I'm picking up, is something that attacks your thyroid gland, right?
Mm-hmm.
And so you don't secrete T3 and T4 to the levels that you need to. Is that right?
Yeah, yes, that can be it. Or, your thyroid signaling part is just not, it could be signaling, and your gland could be so weak that it's just not even able to produce anything. Or it could just be that you're not even able to get the signal to function. There's a lot of stuff that plays into it. That's why it's good to look at all of those different labs to see actually what is going on. But when you have that autoimmune side, your body starts to develop antibodies. And so your antibodies are what you want to look for to see if you're thinking that it is autoimmune rooted. And so the main ones you want to look for is like TPO. And I don't want to mispronounce it, but I always say TPO. And then there's your thyroid antibody, which I always just put, I think it's TGAB is how I always write it when I look for labs.
Make it so confusing.
I know. But you want to make sure you just tell them that you want to run your thyroid antibodies, and most of the time they'll just look at you like, why, what is that? Some people don't even, the doctors and stuff don't even know what those things are.
Crazy.
It is.
But with that disease, that you start seeing the effects like weight gain, right? Maybe a slowed metabolism, sluggishness, like you said. Yes, and so that's Hashimoto's, but there are other disorders of the thyroid gland that are pretty relevant in today's, there's a pretty high percentage of them today. Can you talk about some of those other ones too?
Yeah, so you can have an overactive thyroid, and so that's hyperthyroidism. And so when you have an overactive thyroid, that signal is getting sent, and maybe your thyroid is just pumping out tons of hormones. And so usually those people have a really high metabolism. They usually have a higher heart rate. They're very sweaty, very anxious, shaky people. So if you see somebody that you're talking to and maybe they reach for something and they're a little shaky, it could be that their thyroid is a little overactive. Not very well at sleep. They might have diarrhea. And things like that. It affects all aspects of it. Your brain constantly going, just lots of anxiety. Yeah. And then when you have an underactive thyroid, so just hypothyroidism, that's where you feel just really sluggish, fatigued, slow, weight gain, because you just aren't able, your metabolism's not able to just function the way that it's supposed to. It's, the liver gets involved, so there might be some detoxification issues. Your hormones are completely thrown for a loop. And so we get that. And that's why women get hit with this a lot. And so they'll just be like, us working ambitious women that are, running 2 different jobs, working this job, doing another job, taking care of families, kids, friends, trying to do everything and all, those really who suffer because they feel tired and are just sluggish. They have this brain fog. And then they'll go talk to the doctor, and then they'll probably just prescribe them an antidepressant or just tell them that, hey, you really just need to focus on exercise. And these people probably are already exercising. These people are probably doing what they can. They're just so tired that they can't do anything, or they feel like they can't do anything, but they get up and they walk, or they're going to these super cardio HIIT classes and things. And that causes more stress on their body. And so it actually makes it worse for sometimes of those people.
Yeah. Okay. So you can have hyper or hypoactive thyroid. And you talked about what happens when you have both of those. So that's good. With all of that foundation, I would love to get into what you do in your practice, which is talk about how to manage all of these issues with things like nutrition, stress management, maybe a little bit of exercise. And so let's do this. Let's start with the hypo folks. So people maybe like Hashimoto's or anybody that has a slower acting thyroid. So what are some of the best tools that these folks can use? I know you talked about a little bit of nutrition stuff, but what can these folks do to help alleviate some of the burden that they experience with hypothyroidism?
Well, a lot of it, is stemming from the gut. You want to kind of get down to the root cause, like what causes this. And so you have to do a deep dive into what's going on with their history and their lifestyle. For food and nutrition, that's just a small piece of the puzzle. But if it is Hashimoto's, looking into some food sensitivities, maybe there's some foods that aggravate that. And like I said, gluten is really a big source of that type of thing. But there could be other things, soy, nightshades, corn, eggs. There's lots of different things that could play a part into it. So just really kind of pinpointing and listening to your client. But the best is making sure you're getting whole, real foods. You want to stick to what needs to be organic from the Dirty Dozen list, stick with that. If they are doing meats and stuff, 100% grass-fed, grass-finished beef, get those omega-3s, good fatty, clean fish. You want to stay away from toxins and chemicals, PBA-free cans, because all of those toxins and chemicals, stop that process of converting those hormones that need to happen. And the same, you do actually the same for the hyperthyroid, except maybe they need to eat small, frequent meals throughout the day because they're burning through so much. And so really fibrous foods you want to give. And there's some studies out there that talk about cruciferous vegetables in the thyroid and those goitrogen type effects that they have. And so you don't want to drink kale juice, chug it all of the time, every single day. But, working with your dietitian, to find your threshold for those types of things.
So when you say cruciferous though, you mean things like broccoli and
cauliflower, kale, those green leafy, like we always think they're so healthy. Iodine plays a big role. Too little can cause problems. Too much can cause problems. And iodine is not easily checked. It's not like a lab that you go into the doctor and they just draw your iodine level. The best source is a urine iodine, but so many people just don't run those. So making sure you have the right amounts of iodine. Soy can play a part in that, and it's different types of soy. Real true soy shouldn't have too much of an effect, and you can have in moderation. But processed like soy sauce and that kind of stuff, it can play around with that as well. Your thyroid cause issues. So there's some things that you want to steer clear from for sure, or kind of be cautious of.
Yeah. And so I do remember from way back in the day when I took endocrinology that iodine does play a huge role in the thyroid axis.
Yeah.
And the best source of iodine these days is salt, right? Because
iodized salt.
Yeah, iodized salt. Yeah. And because it didn't used to be that way. And I think they started to see like way back in the day, all those issues with thyroid, like goiter and all that stuff where it's just enlarged. And so if you do need to get more iodine in, I guess increasing your salt intake would be good.
But you don't want to do that. And you don't want to cause other problems with that and cause, a potassium imbalance. But seaweed is another good source of iodine, or kelp.
Okay.
And there's some different fish and stuff like that. The other thing that causes a lot of issues is that fluoride actually inhibits the iodine to be able to bind to those hormones. And so we have fluorinated water, and, fluoride was a big popular thing with our dental health. And it actually causes a lot of issues with your iodine in your thyroid.
Huh. Interesting. Okay. Well, what about, I'm just thinking out loud, what about with these people because they have issues with weight management? Is it recommended for these folks to eat more of a calorie restricted diet, or would that be counterintuitive to what they're trying to do?
I am a dietitian and I hate the word diet. I'm anti-diet dietitian, and I never use the word calorie. I think that calories are weight. They don't really have a point for nutrition aspect of it, because it's just a number. It's just a number. Because I can tell someone, okay, you're on an 1,800 calorie diet and they don't eat breakfast, they don't eat lunch. They can go to McDonald's and eat 1,800 calories, hit their goal. But is that healthy? Absolutely not. So it's really about the different types of foods and the macronutrients and the micronutrients and the vitamins and minerals, the phytonutrients. All of those things play a huge role, and they break down, and the things that they break down into, your body has to use for something else of function. And so it really does come down to a variety of the right types of foods. And so, like I said, food and nutrition is just a little part of that, but lifestyle plays a huge role. The stress, our lives are so stressful, and especially after this last year, it's been just a crazy amount of stress for every single person, how to survive the year with what's been going on. But just daily stressors of, driving to work, having to pack a lunch, those are just added things that are, we put on ourselves every single day. Making sure we get to do all of the functions or do things for our kids or for our pets and things like that, that just adds that extra stress. So we function at high amounts of stress every single day. And then when we get hit with big factors of a disease or a death or, loss of a job or change in, financial status, that just throws our system in for a whole nother loop. And it's not prepared for that because it's already at a higher stress level. And so stress management is big. And I look into stress management with my patients. We really talk about sleep hygiene and do a lot of mindfulness practices and meditations, yoga, stretching. I do incorporate exercise movements. A lot of times it's strength training and just low impact type of stuff with these patients, because you don't want to have them jump out. That's what I did after my son was born. And I was having lots of fatigue, and everyone's just like, you're a mom to 2 kids. You're tired. You're breastfeeding. You're tired. And I was like, this is a different type of tired. Mm-hmm. I was like, okay, I know I need to exercise. That's going to help boost, my good mood. And I was doing these hardcore classes, and then I would just be exhausted because I was exhausting all of my reserves of my hormones, and it was causing a cyclic effect. And so really knowing what types of exercising that's good for your body depends on how much of that stress that you're going through, what all cycle of, cortisol is happening in your body and those types of things. But you do want exercise. It's just, you have to get the right type of exercise.
Yeah. And I think I would love to chat about that a little bit more, because I'm just trying to put the dots together, but I'm a huge advocate, as I work with a lot of overweight and obese women in a research setting. And it's funny because most research trying to elicit a weight loss response would be just basically put them in a moderate intensity aerobic activity, and we'll try to get this weight loss going on. And I'm like, well, these women are like 50 to 100 pounds overweight. Orthopedically, they just can't take it. So they end up not enjoying it. Their affect with an A toward exercise just is completely reduced. And so I'm a huge advocate of strength training. I like strength training myself. But for the most part, what we see anecdotally and in research is that women that are bigger bodied, because they have more muscle mass, are just generally stronger. And so they enjoy exercise more. So I can imagine that with a woman that has experienced issues with hypothyroidism and maybe has gained a little bit more weight, their affect toward exercise could be improved with something like resistance training, like you're saying. And in addition, they get the added benefits of not necessarily draining the reserves that they have, like you were talking about. So it's like a little double whammy effect. So I can see that would be really beneficial for their mindset and just their energy levels.
Absolutely. You want to focus on building that confidence and building that strength at the same time, because they want to trust their bodies again.
Yeah. And metabolically too, I know we talk a lot about aerobic activity improving the metabolic health of the muscle, but at the same time, you're not necessarily getting some of the physiological adaptations of the muscle that you would be getting if you were strength training. And so I think it's more of a healthy approach. It sounds like it would be more of a healthy approach to fitness for these women that struggle with these things.
Absolutely. And your thyroid plays a part on your bone health, and also your joint. You have a lot of muscle cramps and joint pains when your thyroid levels are off. So they already are, if you stretch or move, they're already in pain. They're beginning in pain. And so having them jump into a crazy routine is counterproductive. And so really, thinking about what actually is going on with their bodies right now. And sometimes it could, their cramps and stuff could be from lack of magnesium or low iron. But that's why you really have to do a complete deep dive into what's happening with them, so you can kind of help relieve that, and then work them into stretching and getting to move, and then building that resistance training and things like that to get them going.
Hmm. I do want to circle back too. You mentioned something that I've not really heard of with stress management, which is sleep hygiene. Can you talk about that a little bit more?
So we live in a world that people struggle to sleep. And so it's really just coming up with a sleep routine, making sure that when it's time to go to bed, you start to dim the lights. You have a routine to shut down, tell your body that you're stopped for the day. I always liked when I watched Mr. Rogers as a kiddo, he would come in, open the door, he would take off his like work clothes and put on his little sweater, and then he's changing into, I'm home now. I've put away my work day. And so for us, a lot of times we come in and we throw our work and stuff down, but then we might do something. We're watching TV while we're doing stuff. We might be still looking at reading materials or, studying, helping our kids. We never shut down until we crash and then we go to bed. You're not able to sleep. And when we sleep, it's kind of like a nighttime cleanup crew. We're supposed to have those cleanup crew come in and help remove the things that we need to remove from our body and heal the things that actually need to heal. But when we're not getting the right type of sleep, that cleanup crew can't go and do its job. Or let's say we eat something late night and our bodies are like, okay, we're fixing this in. Oh my gosh, she just ate some ice cream. She just ate ice cream. So now we're going to have to break down this ice cream. Hold on, cleanup crew. So really allowing your body to rest and sleep and get that amount of, some people, they say, always around 8 hours, but some people need more, especially when you have a sluggish thyroid at first. You do need rest. So many of us have that stress and our cortisols are off, and you do need rest. And our work, our lifestyles do not allow enough time for rest.
Yeah. Yeah. That's good. Sleep hygiene. I think I need to work on that myself, but
I know. So I always tell them, do a bath, light a candle, turn off the lights, put your phone away, and don't sleep with your phone next to you. Put it, if you can get it out of the room, if it is your alarm, put it as far away from your head of your bed as possible. Even those lights and stuff that you have around, an alarm clock light, that can still go into your eyes when your eyes are closed and affect the rays affect that, the waves do. So really setting, just like you have a wake up routine or a morning routine or whatever you do to jumpstart your day, you have to have the same type of thing at when you go to bed.
Yeah. Interesting. Okay. So we talked a little bit about the hypothyroidism type of people, and I can imagine that some of those practical ways to alleviate those burdens transfer over to the hyperthyroidism type of folks.
Yes.
But at the same time, I can see how other things like maybe lower intensity exercise wouldn't be as beneficial. Like you want to get these people probably running and sprinting or doing high intensity interval training or something like that, at least in my mind. But can you talk about maybe some of the differences in how you would approach exercise, nutrition, and stress relief in these hyperthyroidism type of people?
So you want to manage the sleep hygiene, you want to manage the stress just like that you do, because that plays a big role into it. And then these people, they have that excitability and their body wants to move and stuff, but you want to make sure that you have enough fuel to be able to, because if you're under eating, you're doing your whole body a disservice. You're just digging a deep hole, and you're just causing a whole lot more problems on your body. It can't carry that workload alone. So you have to make sure that they're not overcommitting to exercise. They're not doing too much. These are the ones that want to, marathon train and do all of this type of stuff all together. And it's like, okay, we have to make sure that you are supporting your body in a healthy way with, supplementations, your vitamins and minerals, your food, to be able to do those types of activities. Because you don't want to exhaust, because that's what a lot of times will happen, is that most of your hypothyroid patients had a time of hyperthyroid. It's that your thyroid hormones are producing too much, and they're done. They're over. And so you now then develop hypothyroidism. And so you do not want to cause that cycle.
Yeah. Okay. So that's good to know. So they need to be fueling properly. Like you said, maybe space out your meals a little bit more, there's a lot of research geared toward that area anyway, which is kind of cool. So they need to space out their meals a little bit more. They probably need to eat more than what other folks probably do, because they are burning it up so much.
Yes.
And then I'd imagine that, you know, pre-workout and post-workout nutrition is pretty important for these folks too.
Very much so.
Yeah. And what do you recommend for that? Do you have any recommendations for eating
It
around?
depends, and it depends on what their status is when they get to me, you know, because you have to kind of play around with some of those macros and stuff. You know, I want them to get carb in some type of way. You know, I don't want to restrict a complete food group at any and all cost. I want them to get how our bodies are designed to function, you know, get some type of carb. Now the carbs, not all carbs are created equally.
Yeah.
And so I worked with a dietitian, and she was at the research center many years ago. I think she's now at the heart hospital, but she would do a talk and she'd work with all these athletes, and she'd like, don't be taking these weird supplements, the protein supplements and stuff. When I say, you know, when your coach tells you that you need to like gain muscle mass, that doesn't mean you get to go have a free for all at Burger King or, you know, things like this. You still have to put the right types of food in your body. Like a ham sandwich is just wonderful compared to some, you know, protein type of shake. You know, the carb amount, the fat amount, the micronutrients and macronutrients in a ham sandwich. You don't know all of that from the protein type of, you know, shake. Not that I'm anti-supplement or anything like that. It's just, you have to know what your body needs at that time with what your exercise is doing and what their status is before, and what you, after you're working with them, you see how much they get depleted. Everybody is completely different. Everybody's completely different.
Yeah, which is good, because I just had somebody on that was talking about, he is the coordinator of nutrition for the San Francisco 49ers, and he is he is all about precision nutrition. So it's really good to hear that in practice you focus on that too, because every body is different. And I think that your approach to treating everybody with exercise, nutrition, and stress management should be completely different too. So it's all contingent upon what they need.
And I think that's what happens with people. You know, they hear, oh, well, so-and-so over here, they're doing this, and look at them, it's working for them. I'm going to do that too. Well, my body's different. My microbiome in my gut is different. My stress level is different. My sleep hygiene is different. My workload and life load is completely different from that person. I'm not going to get the same results. Even if I'm eating the exact same foods, the same results are not going to happen. And so we have to take that, you know, comparison part out of it. You have to start from scratch with every single person.
Yeah. I think that's so good. Well, this was great information. Do you have any more words of wisdom for these people, or for maybe any other people that are practicing as registered dietitians or training to be registered dietitians? Advocate for your health. You know your body best. You are the only one that can, you know, you're the only one with that body, and it's the only one that you're going to get. So if you feel that something's going on and you're not getting the answers that you're being told differently, or like, we don't need to run that test, or it's okay, you don't need to get a vitamin D test, or we don't have to worry about that. Why would you want to look at antibodies? That might not be your person. You know, when you try on clothes and it doesn't look like a good fit, you put it back on the rack and you go get something that is a good fit. It is the same with practitioners. You get a good fit for you. There's so many people out there, but you really want someone to listen to you and hear you and support those decisions and support your body in a healthy manner. So be your own advocate is what I always have to say, because I found myself without any support. And I mean, you're lonely, you're frustrated, and then you don't feel good. And you're stuck. And so there are people out there that can help and believe you that something's going on. Yeah. I love that, advocating for your body. And I do think there are people out there like yourself that are going to be supportive in helping you treat what's going on. So with that in mind, where can people reach you if they wanted to reach out for information or advice?
Absolutely. You can find me on my website is meggreenrd.com, and you can just message me right then and there, or you can email me at meg@meggreenrd.com. I'm also on Instagram, and that's meggreenrd. And then on Facebook, it's Meg Green RD. I'm trying to keep it real simple.
That's good. And I'll have all that information in the show notes for sure. But definitely check out her website. I think this is awesome information, and I'm so excited to be able to connect with you, Meg. And I look forward to future conversations for sure.
I know, this is so fun and it's needed. I mean, just today people were like, you're going on Brittany's show? Oh my gosh, I can't wait to hear what's going to happen. So it was a lot of fun. And you could tell that the support was there. People want to hear what's going on.
Yeah. Awesome. Well, Meg,
guys, you have got to check out my brand new book entitled Through His Strength by Improving Ours Family. This faith-based family study is dedicated to improving the health of the family unit. And on top of this book, I've also created a health leader guide where groups of adults can get together and share different ways that you can approach health-related conversations in the family unit. My book is available on Amazon and other e-book publishers, and all of the other information is available on my website, www.drbrittanyRallman.com. That's www.drbrittanyRallman.com.